Bismillahirrahmanirrahim. Assalamu alaikum, dear all students. I am Zakirullah, lecturer medical laboratory technology, the glycated hemoglobin. In this lecture, we will be learning about the introduction about glycated hemoglobin, what is the structure of glycated hemoglobin, the normal values, what are the factors that affects these normal values or the values of glycated hemoglobin, what are the American diabetic guidelines and what they recommends about these glycated hemoglobin. For the testing and quantification of glycated hemoglobin, what are the specific specimens requirements, and in the last we will be learning about the quantification methods, that how to quantify, how to determine the quantity of glycated hemoglobin. So this is our today's lecture. Coming to the introduction of glycated hemoglobin. Glycated hemoglobin are also called glycosylated hemoglobin. It is basically the formation of a hemoglobin compound in which a glucose or fructose or their derivatives, they react with the amino group of the hemoglobin compound. The glucose molecules attach non-enzymatically to the hemoglobin molecule to form a ketoamine. In this glycation or glycosylation, there is a relation between the plasma glucose quantity and also the rate of glycosylation. So the rate of glycosylation or the glycated hemoglobin, it is directly proportional to the plasma or the blood glucose concentration. If the concentration of the blood glucose it increases, so the glycated or the glycosylated hemoglobin, its quantity also increases. And when the plasma level, plasma glucose level or blood glucose level, it decreases, its concentration decreases. So in the same way, the glycated hemoglobin, it also decreases. So glycation is the non-enzymatically attachment of glucose molecule to hemoglobin, and the end result is a ketoamine. So this is introduction. As we know that RBCs, red blood cells, they lives round about 120 days, and in these 120 days they carry oxygen and transport oxygen to all parts of the body, to every tissue, to every cell. So the glycated or the glycosylated hemoglobin level, it represents the previous 2 to 3 months blood glucose level, that what was the average blood glucose level that is coming in the previous 2 to 3 months, or we can say that from 8 weeks to 12 weeks, because in the lifespan of red blood cells, these glucose molecules, they attach with the RBCs. So as far as RBC is living and it is functioning its normal functions, so the glycated hemoglobin, it is also attached with the red blood cells. When the red blood cells die, these glycated hemoglobins, they also degenerates, they also destroyed. With the help of this glycated hemoglobin, the clinicians, they can find out what was the time average picture of the patient blood glucose concentration over the past 3 months, and what was the control of the patient over the glucose. If the patient have used more glucose or glucose containing food, so the blood plasma level of the patient will increase, and also the glycated hemoglobin, that will increase. And if in case he has controlled his diet, he has controlled his glucose level over the past 3 months, so the glycated hemoglobin level of the patient, that will be also in the control, and that will be in the normal limits. So we can say that glycated hemoglobin, it helps us to find out the average concentration of the glucose level for the previous 3 months. Coming to the structure of glycated hemoglobin, hemoglobin A1c or HBA1c, this is one of the most detected glycated or glycosylated hemoglobin. In this glycated hemoglobin, a glucose molecule, it is attached to one or both of the N-terminal valines of the polypeptide chain of a normal adult hemoglobin. These are the different types of glycated hemoglobin. In this, we can say that an amino group, it is attached to a hemoglobin A. This is HBA1c, and in the second one, this is a fructose, in which is glycated to the hemoglobin level. So this is called HBA1A1. And in the third picture, in which a glucose 6-phosphate, it is added to the HBA hemoglobin A, which is adult hemoglobin. So this is attached to the amino terminal, N-terminal of the valine polypeptide chain. This is called HBA A2, HBA A1 A2. And in the fourth one, a pyruvic acid is attached to the adult hemoglobin or HBA. So this is called HbA1b. And the most important and the most common, this is HbA1c, in which simple glucose molecule, it is attached non-enzymatically N-terminal of the valine in the hemoglobin. So this is the most important and the most common glycated hemoglobin, which is found in the blood. It is found in the blood most commonly, and the value of this HbA1c is find out. So we can calculate. Friends, this is the reference of the picture. Coming to the normal values of glycated hemoglobin, the glycated hemoglobin or HbA1c is a more reliable method of monitoring diabetes than the random plasma glucose level, because when a patient is performing a test for the random plasma glucose level, so certain substance, certain medicine, certain food that can affect the random plasma glucose level. For example, if a patient is having a diet which containing carbohydrate or which have a rich source of carbohydrates, so that may give us a slightly higher result on that specific random sampling. And if in case we are performing HbA1c, so HbA1c gives us the average results of the previous 3 months. So we can get the average diet control, the average glucose control, the average diabetes control of the patient for the previous 3 months. So HbA1c is more reliable than the random plasma glucose level. And the normal values of the HbA1c, it ranges from 4.5 up to 8, and for every 1% change in the HbA1c value, there is round about 35 milligram per deciliter, which is the conventional unit, or for the SI unit we can say that 2 millimole per liter. It changed the mean plasma glucose level. So this point can be understood from this image that shows us the correlation between the mean plasma glucose level and the HbA1c level. For example, if we have the mean plasma glucose level, that is 65 milligram per deciliter, so HbA1c percentage, that will be round about 4, and if it is around about 100 milligram per deciliter, so the HbA1c percentage, that will be about 5, and up to 135 mg per deciliter or 7.5 millimole per liter, the HbA1c percentage, that will be round about 6%. So this shows the correlation between the mean plasma glucose level and the HbA1c level. If the plasma glucose level, concentration increases, so the HbA1c percentage it also increases, and if the plasma glucose level it decreases, so the HbA1c level also decreases. So this is the correlation between the mean plasma glucose level and the HbA1c level. What are the different factors that affects the hemoglobin A1c level or the glycated hemoglobin level? So the relationship between average plasma glucose level and HbA1c level, it can differ substantially depending on the patient diabetic or glycemic control. These two factors, they determine the glycosylated or the glycated hemoglobin level. The first factor is the average glucose concentration, and the second factor is the red blood cell lifespan. If the average blood glucose concentration it is increased, so the HbA1c level it will be also increased, and if the average blood glucose level it is decreased, so the HbA1c level will be also decreased. The second option, the second thing that affects the HbA1c level is the red blood cell lifespan. That what is the lifetime of a red blood cell? If the lifetime of a red blood cell is complete 120 days, so the HbA1c level that will be also increased. Or in another case, if there is any hemoglobinopathies, if there is any hemoglobin disorders or any other red blood cell disorder, so the red blood cells they may die before their 120 days. So it can affect or it can decrease the HbA1c levels as compared to the average glucose concentration. For example, if SL is having a 100 days lifespan, so the 20 days which is a gap between the total lifespan from 100 to 120, so this can affect the HbA1c level, and the HbA1c level that will be decreased for that person who having the hemoglobinopathies or any other disorder, any other disease that affect the lifespan of red blood cell. RBC lifespan is decreased due to other disease, for example hemoglobinopathy, so the hemoglobin will have less time to become glycosylated, and the glycosylated hemoglobin level that will be decreased as discussed earlier. The American Diabetic Association, what did they recommend for the diabetic persons? What are their guidelines for performing or to find out the concentration of HbA1c level? The HbA1c test can be performed at least 2 times annually with patients who are meeting treatment goals and have stable glycemic control. This means that a diabetic patient who have a good diabetic control or a good diet control, or he is taking any medicine, having any treatment, and he is reacting to his treatment, so he will have to perform 2 times the HbA1c in an year. He can perform his HbA1c 1 time in a 6 months. For patients whose therapy has changed or who are not meeting a glycemic control, a quarterly HbA1c test is recommended for those patients, because to check out their average glucose plasma and to check out their glycated hemoglobin level, it is important. We have to find out that if the patient is reacting to this treatment or not. If the patient is reacting to treatment, so the HbA1c that will be performed annually 2 times, and if he is not reacting to the medicine, if he is not reacting to the treatment, if he is not getting better with the treatment plans, with the diet plans, with the exercise plans, so he will have to perform HbA1c test quarterly. HbA1c allows more timely decision on therapy changes and has been shown to result in tighter glycemic control. If a patient is performing HbA1c timely, so he can take a right decision on a right time, and his therapy can be changed on a right time. and it also helps us to maintain a tighter glycemic control or to maintain a good diabetic control of the patient. Lowering HbA1c than 7% has reduced the microvascular, retinopathic and neuropathic complication of diabetes. If a patient is maintaining his HbA1c level below 7%, so this can help the patient to reduce any disease related with the microvascular structure or that is related with the retinopathy, which can decrease his eyesight or that affects the eyesight of the patient, or any other psychological disorders that is related with the diabetes. So decreasing the HbA1c percentage below 7%, that can help the patient to live stronger, to live healthier and to live longer. The HbA1c goal for the non-pregnant adult female is less than 7%. So this is the goal for every male and female that is the non-pregnant, so that can decrease, they can maintain their HbA1c less than 7%. So if HbA1c is less than 7%, then there will be lesser chances of complications that are associated with the diabetes or the secondary diseases that are associated with the diabetes. So their chances can be decreased by decreasing the HbA1c percentage. Now, what are the specimen requirements and the different methods which are performed for finding out the HbA1c level? For HbA1c or glycated hemoglobin, we require a blood sample in which EDTA is added, because this EDTA, this is basically a calcium chelation and it also help in the stoppage of the blood clotting. So the blood do not clot and we can get red blood cells or the hemolyzed red blood cells, or we can prepare a good homogenate of the hemolyzed red blood cell, and we can perform HbA1c from that homogenate. Different methods for performing glycated hemoglobin level, they are grouped into two major classes. The first one is based on their charge differences between the glycosylated and non-glycosylated or glycated or non-glycated hemoglobin. First one of them is ion exchange method, second one is electrophoresis, and the third one is isoelectric focusing. These three methods, these methods are based on the charge differences between the glycated and non-glycated hemoglobin. The other group is based on the structural characteristics of glycogroups on the hemoglobin, that what are the properties, what are the characteristics of the which group is attached to the hemoglobin. The first one of them is affinity chromatography and the second one is the immunoassay. So these are the two major groups which is further divided into 3 and 2 subtypes, from which we can measure we can find out the percentage of glycated hemoglobin.